My doctor says I've got aortic valve disease. What does that mean? Well, the big pump from the heart, the left ventricle, pumps blood out through the aortic valve. If that valve has problems, it can actually keep the blood from coming out easily. That's called aortic stenosis. It's usually if there's calcium in that valve, or that valve has been made where it's scarred down. And we call that aortic stenosis. The blood has a hard time getting out, so the blood pressure becomes low, and people get short of breath very easily, and sometimes will lose consciousness because as they get active, the heart can't pump out enough blood. Exactly the other problem. What if we have aortic insufficiency? And that's where when blood goes out through the aortic valve and the heart rests, the blood tries to come back in. It's stopped by the aortic valve. There are 3 buckets, we'll call them, that come together and they keep the blood from coming back into the heart. If that doesn't occur and you've got some blood that comes back into the heart, then you've got the normal volume plus extra volume, and the heart pushes out huge amounts of blood. That's called aortic insufficiency. That can be due to a bicuspid valve. Instead of 3 buckets, there's only 2, and a bicuspid aortic valve can cause aortic insufficiency. The heart can enlarge, people can become short of breath, their feet swell, they have exercise intolerance. So if your feet swell and you're short of breath and you've got chest discomfort, think about your heart, talk to your doctor about it. If it's aortic valve disease, they can measure what's going on and they can decide if it needs to get fixed. There are new types of surgery to fix the aortic valve. It's not like it was in the old days. If you've got heart valve problems, know that you need careful and thorough and repeated follow-up with your heart specialist.